Hello, I'm Irene Gallagher. I'm the CEO of Being Mental Health Consumers, a passionate advocate who's been involved in the mental health sector for many years now, and I also identify as someone living with mental health issues. Being Mental Health Consumers is a human rights-based organisation. We focus on inclusion, diversity, equity, and ensuring that people are feeling heard, valued and seen. Our motto is actually being seen, being heard and being connected, and that's something that we aim to do, and we believe that it is in line with human rights principles. We pride ourselves on being a fully consumer-run organisation. That means all of our staff are in designated lived experience and living experience positions. So it's a key criteria for the selection of all of our positions. Currently, all of our board also identifies living with mental health issues, so it's quite unique that we have an organisation that is consumer-run, that we understand the needs of our community, and we're able to better support our community through that understanding. We've got a slogan that we get it and we've been there, and that's an integral part of everything we do at Being. One of the other things we pride ourselves on in employing people who live with disabilities and mental health issues is the employment that we're creating. And how wonderful is that when we consider the stigma that exists around mental health issues, that we're able to create employment for people who live with mental health issues, emotional distress and suicidal thoughts. 2020 saw us diversifying our organisation and building an additional arm, apart from our advocacy and the intrinsic work we do, was also developing programs as well. So we have the wonderful Being Supported program, which is a peer support online and telephone support service operating 7 days a week, and of course the Being Leadership Academy, that's bringing education, training and hopefully employment into the mental health sector. Our strong advocacy in relaying messages through to the government and leading and informing systemic change meant that the government have listened, they've heard, and they've recognised the importance of running designated peer support groups for people who experience suicidal attempts and suicidal thoughts. So as part of the Towards Zero Suicides initiative that the New South Wales Government have invested quite heavily in, Being Mental Health Consumers have been funded to operate a number of programs and peer support groups to be able to support people who do experience suicidal attempts and also who live with suicidal thoughts. Some of those programs will operate in Goulburn and Newcastle, but a little bit more centrally in Sydney will be Blacktown, and of course the one in Newtown that I'd like to talk to you today about. The peer support groups are unique in that they bring together small groups of people who are like-minded, had similar experiences, live with mental health issues, suicide attempts and suicidal thoughts, and able to talk about their issues in an open forum, but within very small closed groups. The program runs for a 3-month period and runs on a weekly basis, and in Newtown our meetings will be every Wednesday for a 2-hour period, usually in the morning and sometimes in the afternoons. So if you are interested in attending any of our groups, and quite specifically our Newtown group, please feel free to check out our website at www.being.org.au or send us an email at info@being.org.au and one of our friendly staff will get back to you straight away. We really are hoping to see these groups rolled out across Sydney and the broader New South Wales. We're hoping that we can also cater to diverse groups as well. So if there isn't a group for you or not in your area or not specifically for your diverse community, please feel free to send us an email. Let us know your thoughts. We really value your feedback.